Hey everyone, welcome back to another explainer. We're always taking complex medical data and breaking it down visually so it actually makes sense for your health journey. Well, today we're tackling something that kind of turns everything we thought we knew about age and health totally upside down. We are looking at the hidden cardiac crisis in young adults. We're going to dive right into recent clinical studies and institutional guidelines and make this incredibly important data not just accessible, but highly actionable for you. Let's get into it.
Here's our quick roadmap for today. We'll start with the young heart crisis, then decode some common cardiac terms, look at what's actually fueling this trend, discuss smart screening and testing, dive into the power of prevention, and finally, talk about building a healthier society together. All right, Section 1, the young heart crisis, and shattering that myth of youthful immunity.
So here's a crucial point that really stopped me in my tracks. According to a major study from the American College of Cardiology, out of all young heart attack survivors under 50, a staggering 1 in 5 are 40 or younger. I mean, think about that. It used to be incredibly rare to see anyone under 40 having a heart attack, but now, cardiologists are literally treating patients in their 20s and early 30s. And honestly, the really concerning part is that these younger patients have the exact same rate of adverse outcomes, like, a fatal second heart attack or a stroke, as patients who are a full 10 years older. Youth just isn't the protective shield we thought it was once an event actually happens.
And when we zoom out to look globally, the numbers are just as startling. Get this, data from TATA-1mg shows that India carries a massive 60% of the world's heart disease burden. 60%. And that's despite having less than 20% of the global population. Just look at that second stat there. 25% of heart attacks in Indian men happen before they even hit age 40. Because of genetic predispositions in South Asian populations, cardiovascular events have become this silent epidemic that absolutely demands our attention.
Now, what's really eye-opening here is the clear upward trajectory of strokes in young adults over just a couple of decades in the U.S. Research from an Aga Khan University study shows that for adults aged 20 to 44, the incidence jumped from 17 per 100,000 back in 1993 all the way up to 28 per 100,000 in 2015. So yeah, we are definitely moving in the wrong direction here, and it's happening across the board.
Okay, moving on to Section 2. Let's decode these cardiac terms so we really know the difference.
I love this next comparison because it's such a brilliant way to think about it. It's basically the difference between a plumbing problem and an electrical problem in your heart. So a heart attack, that's a circulatory issue. It's a plumbing problem. A clot blocks the flow of blood and oxygen, and the heart tissue actually begins to die. Usually the person is still conscious and feeling chest pain or shortness of breath. But cardiac arrest, that's an electrical issue. The heart just abruptly stops beating entirely. The person loses consciousness, they stop breathing, and they need CPR immediately. And it's super important to note that a heart attack can actually cause a cardiac arrest.
Similarly, we really need to understand what a stroke is. You can basically think of it as a brain attack. And for young adults, the data shows that 65% of strokes are ischemic. So what does that mean? An ischemic stroke happens when a blood vessel supplying the brain gets blocked by a clot, completely cutting off vital oxygen. This is vastly more common in younger folks than a hemorrhagic stroke, which is when there's an actual bleed. And when you look at the causes behind these ischemic strokes in younger populations, it really breaks down into this incredibly complex web. Unlike older adults where the causes are usually pretty predictable, young adults face all sorts of different triggers. We're talking everything from large artery atherosclerosis to small vessel occlusions to cardioembolisms, which are basically clots that originate in the heart itself. But honestly, the most striking part here is that a massive slice of this pie remains undetermined. That means even with all our modern medicine, sometimes doctors just can't pinpoint exactly what caused a young person's stroke. Crazy, right?
Which brings us to Section 3. What exactly is fueling this? Let's talk about the modern lifestyle impact.
So our modern lifestyle is clearly having a profound impact on our vascular systems. Now sure, traditional risk factors are still massive culprits here. Diabetes affects roughly 1 in 5 young heart attack victims, and high blood pressure is super common right now. But I really want you to look at that top bullet point. The American College of Cardiology found that substance abuse, specifically marijuana and cocaine, was reported in almost 18% of their youngest heart attack patients. Add in the chronic stress of everyday life just flooding our bodies with cortisol, plus highly processed diets, and you're basically looking at a perfect storm for premature artery damage.
Now I really want this number to stick with you. 69%. Franciscan Health points out that chronic sleep deprivation is just a massive trigger nowadays. If you're consistently getting 5 or fewer hours of sleep a night, studies show your risk of a heart attack can shoot up by an astonishing 69%. It's wild. We so often sacrifice sleep for work or going out or binge-watching shows, and we don't even realize the immense physical strain we're putting on our cardiovascular system.
Of course, we also have to touch on recent global health events. Just looking impartially at the clinical data, a major study found that being hospitalized for a severe COVID-19 infection actually acts as a huge risk multiplier for future heart problems. It essentially bumps your risk level up to match someone who already has a history of heart disease. But on the flip side, when looking at prevention, the CDC's data analysis clearly states there is no association between the COVID-19 vaccine and sudden cardiac death among previously healthy young people.
All right, let's jump into Section 4, Smart Screening and Testing and Finding Our Clinical Compass.
So how do we actually catch these issues early? Well, looking at the clinical guidelines, we have some highly recommended baseline tests. A simple lipid profile every few years starting in your 20s is great. It gives you a solid baseline for your cholesterol. And an ECG can catch electrical rhythm issues. But if you look on the right side there, these are things you should absolutely avoid if you don't have any symptoms. For example, the U.S. Preventative Services Task Force strongly recommends against screening the general asymptomatic public for things like carotid artery stenosis. Now, hopping back over to the recommended side. If your doctor looks at your risk factors and says, hey, you're at moderate risk, they might suggest a coronary artery calcium or CAC score. This is such a brilliant tool. It's a non-invasive, specialized CT scan that doesn't even use medical dye. It literally just looks for calcified plaque hiding inside the walls of your heart's arteries. If you score a 0, that's fantastic, but higher numbers tell you precisely how much your risk is elevated, which means you can take action immediately.
But we really need to circle back to why targeted screening is so vital and why over-testing can actually be dangerous. The Stanford Medicine Guidelines explicitly warn that testing the general asymptomatic population for carotid artery blockages yields a ton of false positives. And what does a false positive lead to? Usually a confirmatory angiogram or an unnecessary surgery. And here's the truly shocking part. Those invasive confirmatory tests and the surgeries themselves actually carry a small risk, about 1 to 3% of causing a stroke. So the big takeaway here? Over-testing the wrong things can honestly do more harm than good. You've got to work with a primary care doctor to run the right tests at the exact right time.
Moving right along to Section 5, the power of prevention and taking control of your health.
Look, following these 4 structured steps can dramatically fortify your heart. Step 1, maintain an ideal body weight. Excess weight is a huge driver for high blood pressure and diabetes. Step 2, get that heart rate up, just 30 minutes, 5 days a week. It strengthens the heart muscle and gets that circulation flowing. Step 3, prioritize that deep restorative sleep we talked about earlier to keep your cortisol and stress levels down. And Step 4, avoid tobacco and THC completely. They wreak havoc on your blood vessels and lower your good cholesterol. Honestly, just making these 4 daily choices will drastically lower your chances of becoming a statistic.
And finally, Section 6, A Healthier Society Together, Our Community Called to Action.
You know, spreading this kind of knowledge could quite literally save the life of a friend, a sibling, or a spouse. So please, like, share, and subscribe if you wish for healthier friends and a healthier society. I mean, we are truly happy when we are healthy, and the people around us are healthy too, right? If you engage with this explainer, only then will we reach more people and create the awareness we need to stop this hidden crisis in young adults. And hey, if you want any specific topic covered in our upcoming explainers, please comment below. We want to hear from you.
So, I'm going to leave you with this final thought and a little challenge. What is one small, heart-healthy change that you're going to make today? Seriously, maybe it's just getting that extra hour of sleep or deciding to skip the vape. Take control of your heart health today. Don't forget to drop your requested topics and your daily goals right there in the comments. And as always, stay curious, stay informed, and stay healthy. Catch you next time.